and you have a reasonable lifestyle, then usually this is not something that comes back.
That's fascinating. Ladies and gentlemen, we are talking about breast reduction, breast augmentation. My special guest is Dr. Ravi Somayazula. He is a plastic surgeon who practices here in Sugar Land. Okay, let's give out your contact information and all these things. We'll take a little break, and when we come back, we talk about breast augmentation.
Augmentation, the opposite, yes. So again, my name is Dr. Ravi Somayazula. My office is 3531 Town Center Boulevard South, Suite 102 in Sugar Land. My office number is 281-242-1061. We do have a new website coming out, which will be able to, patients can follow. They'll be able to take a look at before and after pictures, and we'll constantly be blogging and giving information out to patients. But the website is www.bodybyravi.com, and there'll be a lot of information on that. Probably look for that new website in the next month or so.
Ladies and gentlemen, you are listening to All India Radio Houston on 1050 KCHN Houston, Texas. We are here from 10 to 11 a.m. and we would like to thank some of our sponsors. The first one being the Atrium Medical Center, which provides senior care, wound specialization, and outpatient services, and their number is 281-207-8200. I also want to thank Dr. Imran Moideen from South Texas Vascular Institute, who specializes in arterial and venous diseases, and his number is 713-955-1707. I want to talk to the Foundation for India Studies, which specializes in recording the histories from the first generation Indians. You can contact Krishna Vavilala, and his number is 713-795-5169. And we had the pleasure of interviewing Suboto Chakravarti last week about IQ Learning, which is located right here in Sugar Land, who specialize in training students for this class studies and also for SAT, MCAT, things like that. And their number is 832-387-6250. And we are also talking about women and heart disease. I will be speaking to the Jain Center, which is located on 3407 Ark Street in Houston, Texas. For further information, you can contact Ashok Singhavi, and his number is 713-789-2338, and this is going to be on February 22nd, 2015. And as you know, February is the month for recognition of women and heart disease. If you'd like to join in the conversation, the number to call here is 281-745-4161. I am Dr. Nik Nikam. You are listening to All India Radio Houston, and my special guest is Dr. Ravi Somayazula. He is a plastic surgeon. And one thing I wanted to ask you before we went on the break, and that is, do you do any kind of psychological evaluation on a lot of your plastic surgery patients?
Well, that's a good question. A lot of it just has to just depends upon just taking a good history and physical. If I feel like in their medications they're on Prozac or all these antidepressants, antipsychotics, then that's a red flag that they're probably seeing a psychiatrist, or at least hopefully they're seeing a psychiatrist. And if they are, then I'll consult with their psychiatrist to make sure that they're emotionally stable to make this type of decision. But it doesn't happen often. But
if they have a deep-seated emotional problem, plastic surgery may not fix their emotional problems.
Exactly. So you have to sometimes figure out what their underlying issue is, and it's and even if they're not on medication, it's a tough subject to approach with a patient, to try to nicely tell them that they're potentially crazy, but I've never. It happens. The issue comes up infrequently, but it does come up. It's not often, but it does.
Because we want to help the whole person. Plastic surgery, that's one element, and as I said, if they have emotional problem, if that is not fixed, that's not going to help. Okay, let's switch gears now and talk about breast augmentation. So breast augmentation is a little different from the breast reduction, right? In terms of how much of it is cosmetic and how much of it is medical.
Okay, so 0% of it is, well, I wouldn't say 0% of it is medical. I would say the majority of it is cosmetic. This is not a procedure that's covered by your insurance company.
What about those people who have breast cancer and who have breast implants?
Right. So that's so there's primary augmentation. This is a woman who does not have breast cancer, has never had her breast removed. She just is trying to increase the size of the appearance of her breasts and that's purely a cosmetic indication. Insurance companies do not recognize that and will not cover that.
I see.
What you're mentioning is a lady who's had breast cancer, has had a mastectomy or removal of her breast.
Yeah.
And we have to reconstruct that breast either with, the one option is to do it specifically with implants, and another option is to use your own body's tissue with flaps to do that.
Yeah.
That is covered by insurance. So
I see,
with back in the late 90s, early 2000s, all insurance companies were required by law now to get everything covered from the time of their mastectomy to their reconstruction.
I see.
All insurances cover that. So if you're unfortunate enough and you're the 1 in 8 and 1 in 9 that has breast cancer, then you should go see a plastic surgeon. I do some breast reconstruction, but you should definitely seek. That's my 2 cents here. We're not talking about breast reconstruction, but you should definitely if seek a plastic surgeon's as well as your general surgeon who's going to do the mastectomy to see what your options are for breast reconstruction. All that's covered by insurance.
Okay, let's talk about breast reconstruction. I mean augmentation. Let's walk us through the same scenario. Somebody walks into the office. I guess these are more generally younger people. Am I right?
Yeah, the average patient that I see that comes in for breast augmentation is a lady that's in her mid-20s to her mid-40s.
I see.
So 25 to 45, I would say, is probably the average.
Yeah, just walk us through, all the things that we might expect so that we have a better understanding of what's involved.
Yeah. So, patient comes in, they're interested in, and a lot of these patients are very savvy, with media and everything. So they've done their research.
That's true.
And unlike, say, for breast reduction, a lot of women who come in for breast augmentation, they will see an average of 3 plastic surgeons. So I'll be the first, or I'll be the middle, or I'll be the last.
Yeah.
And so they'll already have some idea of what this is. So they're actually quite savvy as far as the procedure is concerned. And you're kind of sitting there talking to them about the process. They're just nodding off to sleep because they've heard this before. But basically, we sit down and we talk to them, get a medical history, make sure they're healthy enough for surgery. And then, we talk about making sure that they don't have a history of breast cancer. If they're, in the 35, 37 range and they have a history of breast cancer, then we might ask them to get an ultrasound or a mammogram to make sure that there's no issues with breast cancer, that they don't have breast cancer. And the same thing goes true actually for breast reduction surgery. So
that's a very important point.
Yeah, anytime you operate on the breast, whether it's a breast augmentation, breast reduction, you got to be careful making sure that if a patient has a high breast cancer risk with a first-degree relative, then that you do your due diligence to make sure that their mammogram is cleared before you operate on them. So we do that routinely. And then once everything else is fine, what we do is we sit down, we talk to them, and we have sizers in our office. And those sizers give the patient an idea of how big they want to be. So they usually bring in a form-fitting shirt. We give them a surgical bra, and then we put sizers in. And that actually enhances the size of their breast. There's different sizes that they can choose. And during that process, they look in the mirror and they kind of get an idea of how big they want to be. A lot of women have different ideas about how big they want to be. But what I tell patients is one size doesn't fit all, and everybody is a little bit different, and a lot of it has to depend on their anatomy. No 2 women are the same, and no 2 breasts are the same. They're not twins; they're sisters. So basically, based on that, after their sizer, I take measurements. And then based on our discussion, our mutual discussion, I'll tell her, okay, Mrs. Jones, you're interested in a C cup or a D cup. And to try to get you within that range, we can use this size implant, but these implants we can't use because of your measurements. So I use my objective measurements along with the patient's concerns about how big she wants to be based on the sizers, and we kind of bring those 2 together to figure out what implant to put in the patient.
What happens if a young lady says, well, I want the largest breast implants and all this? Do you feel that there are certain points where you may feel, well, this is not appropriate for you?
Yeah. So if somebody just has unreal expectations and they're completely pushing the envelope of what it's not even really a matter of what looks good. At some point, if the implant is much, much bigger than what her anatomy is willing to accept, then you get into significant problems with complications after surgery. So I don't want to put myself in a situation where I do something to a patient where I know for a fact she's going to have a significant complication risk, and then I have to deal with it afterwards. I don't want to deal with it if I can avoid it, and B, if she's consistently adamant about doing something I'm uncomfortable with, I'll just tell her, unfortunately, I can't help you. That's really never been the case for me. I've never had anybody with, I shouldn't say that. I've had a couple of patients with unreal expectations, in which case, we tell them, sorry, I can't help you. But it's, when you sit down and you talk to them, they kind of, and you educate them, they kind of conform to what you tell them.
Okay. let's walk us through this surgical procedure, breast augmentation. Is this different from breast reduction, and how is it?
Yeah, so surgically, actually, the scars for a pure breast augmentation, the scars are much, much smaller, believe it or not.
I see.
And in what I've been using is a special technique or tool in the operating room that actually makes the incision much smaller.
I see. Yeah.
And I mentioned that there's no way of doing scarless surgery, but there are ways of making the scar smaller.
Yeah.
So typically, and going, saline versus silicone is beyond the scope of this. But basically, in a silicone implant, you have to make the incision about 4 to 4.5 centimeters.
Yeah.
Now I'm able to make it about 3 centimeters. And believe it or not, that 1.5 centimeter difference makes a difference to a lot of patients. So basically, I use what's called a Keller funnel. It's a new technique. I don't know, a lot of plastic surgeons use it. There is an additional cost to the surgery, not much. But it's an advantage because the Keller funnel doesn't allow the implant to touch the skin, so it makes it cleaner.
Yeah.
It allows me to make the incision much smaller, and it actually decreases the operating time. So all those three things are actually very, very favorable. And basically, the incision is pretty much right underneath the breast. It's about 3 centimeters. And the procedure, whereas in a breast reduction, the operation takes me about 3.5 to 4 hours because a lot of cutting and sewing. In a breast augmentation procedure, you're looking at typically an hour to an hour and a half.
I see, yeah.
So the procedure, less time, same day, you go home the same day. It's a lot of these patients that come in, if they're really young, they don't need a lift at the same time to give them a good shape. Some patients that come in thinking they just want an augmentation, if you sit down and you talk to them, they also require a lift to give a better shape. And that lift is very similar, not exactly, but very similar to the scars that you get with a breast reduction. So now you're having a discussion with the patient thinking, oh, well, I thought I'm just going to have a 3 centimeter scar at the bottom. What are you telling me I need this other scar for? And then sometimes it becomes a little bit of a discussion about why you need the scar to give it a better shape.
So is this lift a different procedure?
Yeah, the lift is a different procedure, but you do it at the same time as the augmentation.
Oh, okay.
Now, there's risks of doing it at the same time. There's benefits to do it at the same time. But for the most part, unless you got to make sure that you're not a smoker, and if you're not a smoker, because smoking causes problems with wound healing. If you're not a smoker, then we can go ahead and do the augmentation and the lift surgery at the same time.
Okay. So, and since we said it's mostly cosmetic surgery, most people, the first question they're going to ask is, how I look. And the second question, of course, is cost.
Right.
Just give us a range.
Yeah, so if you're looking at just a breast augmentation procedure, the cost starts at about $6,500, but that can vary depending upon saline versus silicone, if you need a lift or not on top of it.
I see, yeah.
And just as a side, I don't deal with my office, deals with we have different financing options. So there's things out there like Care Credit, Alpheon, and believe it or not, bank financing. Some patients of mine have actually gone and taken out a loan. And so there's different ways of financing it. All that money doesn't have to be upfront. And so there's ways of financing, just like you would finance a car or whatever, there's ways of financing plastic surgery, and we do that all the time. In fact, the majority of what we do in pure cosmetic surgery, most of it is I would say, financed.
I see,
But we have different options to be able to make it affordable to patients.
Okay, let's give out your contact information, and then we'll take a little break, and we'll switch gears and talk about tummy tucking.
All right. So Dr. Ravi Somayazula, Body by Ravi. The office address is 3531 Town Center Boulevard South, Suite 102 in Sugar Land. The office number is 281-242-1061. And as I mentioned, we have a website, a brand new website that's going to be launched in about a month or so, and you'll get a lot of information on it about all the things that we're talking about today. The website is www.bodybyravi.com.
Good morning, ladies and gentlemen. I am Dr. Nik Nikam, your host. You're listening to All India Radio Houston on 1050 KCH and